are you doing today?
Good, how are you?
I'm good. So, could you tell me a little bit about yourself?
Yeah, I went to school at Shenandoah University. I graduated with my BS in May. I did track and field there. I was actually the captain of the track and field team. I was the vice president and the president of SNA, and I also worked multiple jobs while studying for my nursing.
Awesome. So it sounds like you were part of a lot of things. So, like, how did you manage your time during this time?
I'm not gonna lie, it was like pretty challenging. But what I really did was I made sure I knew what was most important. I prioritized everything. So obviously my degree was the most important thing to me, and all of that knowledge that I gained from all that was very, very important to me because I was going to be using that for the rest of my life. I made sure that I made all my responsibilities for all of everything else, like my work and SNA. And I really, really enjoy track and field, so that was my me time. So it was like a really good balance, actually.
Awesome. So tell me why you're interested in the emergency department in general.
I've always kind of been drawn to the emergency department. It's definitely fast-paced, and I really, really like that. But what really, really, captures my attention is the fact that we are the first thing those patients see. We are the first people they meet. They're going to get their idea of what the stay is going to be like with us, and we get to, really figure out what is going wrong with them and, try to see what they need and where they need to be sent to or what they need to be carried out.
Awesome. So tell me about the most memorable experience you've had in the ED.
One of my most memorable experiences that I had in the emergency department was actually, it was actually kind of a sad situation. There was a 26-year-old man, so barely older than me at the time, and he came in through the ambulance, but his background was that in January, he was sober driving, home from New Year's Eve, and a drunk driver hit him, and he suffered a lot of internal injuries, some of them being cranial, and he was in the hospital for a very, very long time, and then he got discharged, and he was okay, and he was at home, and then, I started my internship in June, and he came in because he bumped his head while he was, doing something like plumbing or something like that, and an aneurysm broke, and he just was so sick, and the reason why it stuck with me was, one, it was very clinically, obviously there was a lot going on, it was really fast-paced, it was my first really serious incident, but most of it was the background behind that. I have a really strong passion for no drinking and driving, and it just kind of really solidified that fact with me, and helps me to tell that to other people.
So how would you approach a patient that was, how would you have approached a patient that was the culprit of the incident, the DUI driver?
So I would approach them just like every other patient. Patients come in and they have a need, and everybody makes mistakes, like I'm not a perfect person, and I'm sure you've made mistakes before as well. Those mistakes don't define you, so I would treat them just like everybody else.
Cool. So tell me what your greatest strength is, and how does that relate to nursing?
My greatest strength, I would definitely say, is I think my teamwork skills. I collaborate with others really, really well. I'm very energized, and I like to have a good positivity, around people, and I think it's just contagious, and I help people when they, need help, and, it's just a give and take almost.
Awesome. So on the flip side, what is your greatest weakness?
My greatest weakness is that I tend to take on a little much. I like to, do the most and do the best that I can possibly do, but sometimes, we do need to take that rest and relaxation time because if you're constantly running, you get fatigued and you kind of crash.
Awesome. So what do you look for, I guess, what do you expect from your supervisors from this hospital? Like, what do you, for your growth as a new nurse, what do you expect from us?
I kind of hope to see just kind of understanding. I am a new nurse. I haven't had years of experience. I'm going to have questions, and I know that. And there's going to be things that I don't know how to approach, and I would hopefully see that, they're easily approachable, and, they're good with teaching and educating nurses and making them as strong as they could be on the floor.
Awesome. So, what is the difference in perfection and excellence?
The difference between perfection and excellence. I believe perfection is something that you can try to achieve. I don't think anything is ever really, really perfect, but you can always strive to do the best that you can to achieve that certain goal. But I think by doing things, striving towards excellence is a more reachable goal, and it's something that I feel like people are more motivated to achieve because it seems like it's something that's more achievable.
Awesome. So how do you define success?
I define success, honestly, by finding wholesome in mind, body, and spirit, and just collectively. I think if you're working well with your team, if everybody's positive and, you're getting your job done and people are happy and people are getting treated well, and they're leaving and they're just staying healthy and you're educating them so they don't, have those incidents happen to them again, I think that's where, we find that.
What's your 5-year plan?
My 5-year plan, so within the next 1 to 2 years, I hope to become certified, and as much as I possibly can be certified. So I'm already BLS certified, but I want to be ACLS certified. I'm going to have my PALS and, get certified in all the equipment. And then my 2 to 3 year plan would definitely be try to be more of a leader. So I would try to be more on the boards and organizations and work with all of the different services that you have. And then I guess eventually I would hope to get my master's because I really do believe in education and furthering education. I want to further with my nursing and become more of a master in that field.
Awesome. I have several candidates interviewing for this job, and several of which have 4.0 GPAs and all these things. So what makes you the best candidate for this job with that in mind?
I know 4.0 GPAs show that they did really, really well in their exams and they know textbook. But what I've also learned in all of my clinicals is not everything is textbook. And there's going to be instances that you have to feel something out. I have really good interpersonal skills. I really work well with others. I'm very active, so I have good time management skills. I feel like with all that I've done and all of my leadership qualities and all of the things that I've achieved at Shenandoah, make me a more well-rounded person than somebody who just is a textbook learner.
Awesome. I think that's all I have for you.
All right.
I'll give you a call in the next couple of days.
Thanks. I'll be looking forward to it.